Health Minister Dr. Aaron Motsoaledi says universal health coverage is based on the principle that every person should have access to quality health care without facing severe financial strain. He noted that South Africa is the only country to face legal challenges over the implementation of its national health insurance system. Motsoaledi pointed out that the World Health Organization recommends that countries allocate about 5% of their GDP to health. He said South Africa currently spends about 8.5% of its GDP on healthcare, a level that should reflect far stronger health outcomes. According to Motsoaledi, the core challenge remains deep and persistent inequality within the system.
Coverage, as you defined it, means everybody, and everybody means every human being on this planet Earth has got a right to access to good quality health care. And when they request that access, they must not fall into financial hardships or what the World Health Organization call catastrophic healthcare expenditure, where people fall into poverty because somebody got ill at home. Now, each country implement it in their own peculiar way, and it's given different names. In South Africa, we call it NHI. You are aware that the most well-known universal health coverage in our country is the British NHS, National Health Service, which was implemented in 1948. From there, we have got many other countries that has also implemented, but ours is NHI. And you are aware that unlike other countries, we are unlucky because we've been taken to court. There's no country in the world, to my knowledge, which was taken to court for implementing universal health coverage. What has happened is that maybe doctors threatened to go away, they threatened no longer to work for such a government. All those were threats. They happened in the UK in 1948. They happened everywhere, but I believe we're the only ones who have been taken to court.
Today marks Universal Health Coverage Day, which commemorates the first unanimous United Nations resolution calling for all nations to provide for their citizens affordable, quality health care. Activists say rising healthcare costs, that is, are increasingly burdening South African households, strengthening the need for an integrated, collaborative approach to universal health coverage. The Managing Director of the Board of Healthcare Funders, Dr. Katlego Mothudi, argues that while the goal of equitable healthcare is widely shared, the current reforms risk deepening divisions instead of harnessing the strength of both the public and the private sectors. He joins us now virtually for more. Dr. Mothudi, very good evening to you. Thanks for joining us. Welcome.
Good evening, Simpiwe. Thanks for having us.
Now, Universal Health Coverage Day is about ensuring that no one is left behind, yet the healthcare costs in South Africa continue to rise beyond what many households can absorb. So what has fundamentally gone wrong, Dr. Mothudi, in making healthcare financially accessible?
I think if we look historically at the challenges that we had this promise of implementing universal health coverage through NHI, and everything fell by the wayside. From the private sector side, on whom largely the issue of high costs lies, we had a landmark report through the Competition Commission in 2019, through the Health Market Inquiry. From that process, as with some very strong and credible recommendations on what the private sector could do to reduce healthcare, but none of those have been implemented to date. And what happened is the healthcare costs continue to escalate. We are a country that does not have specific billing practices. There's no price regulation on the private side. This is a result of a disagreement on how it was implemented. And this happened in 2009. Since then, there is no guidance. Now, some of these I've mentioned, Simpiwe, are the reasons why, at least on the private side, we've got escalating healthcare costs. And unfortunately, we could not really come together, even through the discussion of the national health insurance, because the private sector felt disregarded. There were thousands of submissions that were made through the processes, and none of this were considered. And we feel that if there was going to be a coming together of minds. It should have started through the consultation process.
Right, right. And do you believe that South Africa is moving closer to the universal health care coverage, or drifting further away due to the escalating private costs and the overstretched public facilities?
So what the World Health Organization says that the 2030 goal will actually not be achieved by anyone, any of the signatories, and largely because of what the minister articulated, this catastrophic healthcare costs. Most countries are actually experiencing an increase in cost. So we have to be innovative, firstly in the delivery mechanisms that we proposed, and also in the arrangement that we say. Now, I'll give an example of one such arrangement that did not sit well with those who are on medical aids. One of the funding mechanisms that is being proposed is that of removing tax credits. And these were introduced, I think, around 2011, thereabouts, as a way of incentivizing those who are purchasing their own healthcare cover outside of the state. If you remove this, for an average family of four, you are basically taking away about 14,000 rand that they would have gotten back from the tax submission process. It then renders private healthcare inaccessible to many people. Our own calculations indicate that close to 700,000 people who are currently on medical aid will not be able to afford the threshold level for medical aid. So it is important when you consider this intervention to see to what extent they actually assist the attainment of access to healthcare services.
I mean, we speak of the rising premiums, hospital tariffs, medical costs persisting. Is the private sector possibly doing enough to contain these costs, or is affordability now a structural failure of the system?
You are correct in pointing out to a structural failure of the system, but there's more that could be done. The BHF has, for the past almost 10 years, proposed that we introduce what we call a low-cost benefit option scheme, which would actually allow maybe 10 to 15 million more South Africans who are currently employed but do not afford the regular medical cover to access private healthcare. But that process, just like the frustration the minister expressed, we are equally frustrated because it's sitting in the courts. That policy has yet to be ratified by the Ministry of Health as well as the Council for Medical Schemes. While there are these challenges, we think that there are positive developments that could be entertained. There is a move to introducing private practices. Some of them are nurse-led in communities that could very well go into contract with the schemes as well as government to actually start providing more access at a more affordable rate. You could look at the issue of technology. During COVID, we facilitated the recognition of remote consultation or telehealth. Now, that's another avenue that could be used if funded to actually increase access to those people who require it.
Now that you agree with me that this reveals the depth of, the structural failure of the system, I mean, coming to your argument that, the current reforms risk deepening divisions, what exactly is the government doing then in the reform process that you believe could unintentionally polarize the public and private sectors?
So I think the first thing is for us to discuss and then also listen. We believe that the consultation process for NHI went horribly wrong because many of the submissions that were credible were not considered. So it does require us to actually sit down and look at integration of the system, not scrap one in favor of the other. We do agree that both systems have got challenges, but not everything on both sides is wrong. So we could actually integrate and look at the positivity from both sides. And those proposals, as I've said, have long been articulated. The fact is we do not have unlimited resources, especially on the state side. So if you scrap medical aid cover, you are immediately going to shift 9 million people who are paying for their own healthcare to be under the state, which is already buckling under pressure and not able to provide cover for those that are totally dependent on it.
All right, Dr. Mothudi, great chatting to you. Thank you so much for joining us. We appreciate your time.
Thank you, Simpiwe.
All right, that is the Managing Director of the Board of Healthcare Funders, Dr. Katlego Mothudi, helping us unpack the complex balance between affordability, equity, and the future of South Africa's healthcare reforms.